Hello, everyone. I'm Lila Lazarus, and the question, of course, today is, do you snore? Do you know someone who snores? Does your spouse or partner snore? I know my husband snores. He'd probably be upset that I said that, but if he were here, he'd probably say that I snore as well. You know, some people think of snoring as something that's just annoying, and it can be, but it can also be a sign of something much more serious. Maybe you know somebody with sleep apnea or other sleep disorders. So for some 18 million Americans who snore, it is more than just that annoying noise. They're actually gasping and waking up over and over and over again. You've heard of these people who actually stop breathing, sometimes for nearly a minute. That's sleep apnea. So today we're actually talking with two experts on the subject. We have Dr. Paul Hoff, an otolaryngologist, it's a mouthful, and the head and neck surgery section head at St. Joseph Mercy Health System, but also a surgeon who has done more robotic surgery procedures for sleep apnea than anyone else in the world. Next to him, Dr. Thomas Gravelin, board-certified sleep specialist and medical director of the St. Joseph Mercy Sleep Disorders Center. Thank you so much for being here. People have watched the Discover Remarkable segment, or they are watching it now, about sleep apnea. Tell me what you think the response has been to this show and what you're hearing from patients.
I think the biggest part about this show is that it raises public awareness. Sleep apnea, as you said, hasn't really been recognized as a problem by many people. People snore, and it's always been kind of the butt of jokes at deer camp and other places like that, but a lot of these people have a real serious problem. So I think the best part about this program is just raising public awareness to the problem itself, and then different treatment options. And there are many different treatment options, robotic surgery being one of those, but it's definitely not the mainstay of treatment.
And let's not mince words. When we talk about this, Dr. Hoff, we're talking about something that can be deadly.
Yes, it can be. I think Dr. Gravelin probably can speak to that.
Yeah, absolutely. With sleep apnea and the problems that we're talking about, it's not just about being more perky or having more energy. Sleep apnea is every bit a serious medical problem as high blood pressure and heart disease, and falling asleep behind the wheel is the #2 cause of traffic mortality in the United States, apart from the other health conditions it contributes to.
When someone's snoring to the point of sleep apnea, when do you know it's actual sleep apnea? What is the definition of actual sleep apnea?
Well, the definition is if you stop breathing for 10 seconds or longer, more than 5 times per hour, you probably have significant sleep disordered breathing or sleep apnea. And particularly if it begins to interfere with the functions of daily life, you're fatigued, you're falling asleep driving your car, or you develop high blood pressure, that's something that really you should seek medical attention for.
And the good news is there is something that can be done. We've seen it happen. You're going to see this in the show and Discover Remarkable. Within 2 weeks, you can actually become a person who can have a full night's sleep.
That's right. And it's important to know that when we see people with sleep apnea, the patients that I see have been through a rigorous trial of different therapies, and it's patients who've tried CPAP, or the positive airway pressure mask. They've tried that. They may have tried weight loss. They've tried positional therapy, or even an oral appliance to help with their sleep apnea. People who have tried those and have failed, there is another option, and that's what we want people to be aware of.
So the most important thing is to take it seriously. We already have people calling in. Let's get to line 2. We have Darius from Clinton Township. You have a breathing machine, is that correct?
Yes. Mm-hmm.
But you wake up with a very dry throat.
Right.
So the question is, what can you do?
Well, that's a problem that I see in my practice quite often. And first of all, there's no reason why you should have a dry throat, and that's something that can be fixed. What that usually means is that your mask is leaking. If your mask leaks, all the humidity in your system will escape out the mask and into your bedroom, and you'll wake up and your humidifier on your machine will be empty. That means you're having a mask leak, which can be corrected by your physician or the sleep lab.
How long have you been wearing the mask?
Well, I've had it for a couple of years. I've tried different apparatuses, just the one for the nostrils, and then I went with the full mask. And, you know, I always, during the middle of the night, I'm taking it off.
So I was just going to say, there are so many people who actually have the machine. It sits by their bed, but they don't actually put it on. You've actually been wearing it, but there are times when you just have to pull it off.
Well, I don't even know I do. Just during the middle of the night, I wake up without it on. So
It's a problem I commonly see. It's a problem, again, that's completely correctable. Oftentimes people will pull off their mask in the middle of the night when their sleep apnea is at its worst because their pressure's not high enough. And if their mask is leaking, they're getting some degradation of that pressure and they're not getting the full treatment. I would encourage you to speak to your sleep physician about either having a PAP nap, which is a formal session where you can have a mask refitting in the sleep lab, or having a retitration study to see if your pressure is adequate and to fix your mask leak. But there's no reason for you to continue the way you are.
And another alternative, if that doesn't work, you should consider being seen by an ear, nose, and throat doctor just to have a real careful exam of the upper airway, just to see if there is any obvious physical obstruction that can be corrected, because for people who are intolerant of CPAP for whatever reason, it is nice to know what all your alternatives are, and you might not have actually been presented with all the alternatives. That includes an oral appliance. If you're overweight, as we spoke about, but then also there are some surgical alternatives, and the success rate can be pretty reasonable if the anatomy is right. Everybody's different, so some people are just not good surgical candidates. Just depends on what you're willing to go through surgically. I mean, there's always a surgery, but whether that's the right surgery for you and whether it's tolerable. But I think that's why we're here, is to talk about. At St. Joe's, we have a multidisciplinary sleep disorders program, and we like to offer people all the different alternatives. And I think we offer probably the most alternatives in most of the programs in the area.
Can you tell us what the nature of your sleep is like and how you feel in the morning, Darius?
Well, I'm tired. I wake up tired. During the night I have a dry throat, so I'm going out getting something to drink and going back to bed. So it's interrupted,
And how much has that interrupted your life?
Oh, quite a bit. You're always tired, so you don't have energy to do things. So honesty.
We talk about the pillars of health, knowing that you need to eat well and knowing that you need to exercise. But when you don't have sleep, everything seems to go out the window.
Yeah, true.
And poor sleep will contribute to a number of different medical problems I mentioned already: high blood pressure, heart disease, stroke, diabetes, and further weight gain, as well as just not quite being as functional as you'd like to be during the day.
So you need to go back and see your specialist and find out why you have this dry mouth and why you're pulling it off during the night. If you'd like to see somebody at St. Joe, the number to call, 855-757-6268. That's 855-SJ-ROBOT. Or you can always go to stjoeshealth.org/sleep. Any other questions for the doctors, Darius?
No, that's all.
All right, well, we, of course, wish you a good night's sleep.
Okay, thank you much.
Thanks for calling in. Bye-bye.
Bye.
How typical is he in terms of, we talk to so many people who say they have that machine, but they're not wearing it. Or the wives who complain that they can't stand how the husband looks wearing that machine.
In my clinic, this is the typical patient. Patients have pretty much been screened. I rarely see patients who have not tried positive airway pressure or some other way to treat their sleep apnea. So this is the common patient for me to see. And for every patient that I am considering a surgical treatment, I have a pretty rigorous sort of 3 steps. The first step is just the office examination. We use a little fiber optic light to look at the back of the airway, particularly the back of the tongue. If they look like they may be a candidate, then we do something called a sleep endoscopy. And that's just like we take the patient to the operating room for twilight anesthesia, and we actually look at the airway while they're sleeping. This really complements the sleep study because it actually shows where the obstruction is happening.
And if it's severely obstructed, what does that look like to you? What do you actually see back there?
Well, there are different grading scales, but you'll see the collapse. So if somebody has tonsils that are large, you'll see those collapse and block the airway. You'll see a lot of vibration, which is the snoring, or maybe there's no vibration, which means complete collapse. Then you'll look a little further back over the back side of the tongue, and you might see excess tissue at the back of the tongue that's causing the obstruction. Not tongue muscle, but actually something called tongue tonsils or the lingual tonsils. And then some people have very large lingual tonsils. And when we see all these things, we can put it together and come up with a surgical plan. And those are the ones that I counsel about possible robotic surgery.
We have two renowned sleep specialists taking your questions and your calls today. The number to call, 248-356-0077. And you can speak to Dr. Paul Hoff or Dr. Thomas Gravelin. I think one of the most interesting things I heard from you, Dr. Gravelin, that I think about all the time now, when people think they want to change their sleep pattern, it's always about wanting to go to bed earlier tonight. I'm going to go to bed earlier tonight. But you have said to me once, and it stuck with me, no, it's about changing the time you wake up in the morning.
That's exactly right, Lila. You don't set your circadian rhythm by what time you go to bed. You set it by what time you get up. So if you're unhappy about not being able to get to sleep, set a fairly standard wake-up time. And most adults need about 7 or 7.5 hours of sleep, and then figure out exactly when you need to go to bed to get the 7 hours in. I see sometimes elderly people that don't have much to do. They go to bed at 8 p.m., they wake up at 3 a.m., and then they come to see me because they have a problem. They wake up at 3 a.m. And I tell them, you got your 7 hours in, you're done. If you don't want to wake up at 3 a.m., then you need to go to bed at midnight, and you'll get up at 7 a.m., and you'll be much happier.
And that has stuck with me, I can't tell you how many times. Now, knowing how important sleep is in terms of the pillars of your health and how not sleeping can lead to diabetes, heart disease, stroke, how much of the sleep study, the sleep surgery, is covered by insurance?
Just like everything in our healthcare environment these days, it's an ever-changing playing field. And every single third-party payer I'm aware of has different metrics and different criteria, but almost all of them cover a sleep evaluation to some degree, whether it be as a home study or as a consultation or an in-lab formal sleep study. I think the point that Paul and I are trying to make is there are a lot of options out there, and if your needs are not being met, then raise your voice, ask more questions, or see someone else. I mean, Paul has a great option with the surgery, and I've seen many patients that I've referred to Paul have terrific outcomes, or if nothing else, their sleep apnea becomes much less severe, so they can then go into an oral appliance.
I've seen it too, though. I mean, even with the star of our show, the way you see this woman tired, exhausted, at the end of her rope, she doesn't even want to be with her grandchildren because she doesn't have the energy. And suddenly, she looks more beautiful, she sounds more beautiful, and her life is better. It's almost like she goes from black and white to color. It's really incredible.
Believe it or not, I've had a patient recently who was 33 years old, a little overweight, high blood pressure, comes in to see me. I'm starting to ask this person about being tired, and his remark to me was, well, I'm 33 now, so I think this tiredness is about how you're supposed to feel.
Wow!
I said, absolutely not.
Oh my gosh.
So, because nobody understands how anybody else feels, you only know how you feel, and most of us consider ourselves normal.
Right.
And if this is the way you feel, I guess that's how I'm supposed to feel.
But sleep really can be the fountain of youth. We have another question on line 2. Hi, is this Homer?
Yes, it is.
Hey, what's your questions for Dr. Gravelin and Dr. Hoff?
Yes, I have sleep apnea real bad, and see, I was in a motorcycle accident with a deer on my bike, and ever since then I've had sleep apnea really, really bad. I broke my nose, and I've had it repaired 4 times, and I can't use the BiPAP machine at all, because every time I do, I get a sinus infection. And I'm seeing this doctor named Dr. Mahajan, which wants to break my jaw and wants to put a hole in my throat, and I can't see that happen. I was wondering if they could, any way that they could help me with the sleep apnea I have.
Well, yeah, again, it all depends on where the obstruction lies. The surgery that you're talking about is where they basically reconfigure the jaw, the upper and lower jaw. Basically, when you move the jaw forward, that brings your tongue forward, and that improves the sleep apnea. That's probably the most successful surgery that there is for sleep apnea. And he probably wants to do what he said, the hole in the neck, which is a tracheostomy. That is actually the most successful surgery for sleep apnea, but not very many people want to have that long term. No. This would be just probably a short-term thing while you're healing up from the jaw surgery. And the jaw surgery in the right hand is very, very successful. It's over 85, 90% success rate. So it's hard to argue with that. It has its own set of drawbacks, but it's as far as post-operative recovery. But I think it's all where the obstruction lies.
Right.
The oral
I've
surgery.
had 19 surgeries in 5 years.
Holy cow!
Wow.
All since the motorcycle accident?
Yeah.
Yeah. So I think the best thing to do now, an oral surgeon the only surgical treatment they may have is the jaw surgery, and an ENT surgeon, the only surgery might be removing your tonsils and fixing your nose.
Yeah, I got my tonsils, and my adenoids and my tonsils are gone.
Yeah, so I think if having somebody do a sort of a comprehensive evaluation, making sure that there's no excess tissue at the back of the tongue, and just looking at everything before you go to that sort of extreme surgery. But the surgery that he's describing is a very successful one. So, and that would, if you don't have to use the CPAP anymore, then your sinus infection problem may improve.
Homer, how much you waking up during the night?
I'm up about every 2 to 3 hours. For an hour or so, and then I go back and I'm up every another 2 or 3 hours. I'm up again.
And is somebody complaining about the way that you're snoring and that kind of thing?
Oh, everybody does.
Really?
Everybody does. I'm super loud.
We all know that person. Yeah.
Mm-hmm.
Got it.
Only the bad thing about it is I've had 19 surgeries and I'm having a lot of problems with the painkillers. My pain level don't go below a 6. Since 2000.
And who knows how much sleep would help alleviate so much of those problems as well.
Yeah, I've been having nightmares for 4 years now because I don't sleep.
That's interesting, because so often people don't dream at all when they have
Right.
sleep apnea.
Well, let's see what it is. It's all the painkillers, anesthesias.
Right.
That's what my doctors are saying.
Because I will say, one of the magical things we've heard as a result of what Dr. Hoff does with his surgery is that people who have never dreamed or haven't dreamed in years are suddenly having dreams again, but the good kind.
Well, see, that's what I need to. I think that might be my case because that's what he says. He wants my tongue. My doctor says my tongue is. That's why they want to move the jaw forward because my tongue is shutting off my airway.
Well, if you'd like a second opinion and you want to call Dr. Hoff, the number to call, 855-SJ-ROBOT. 855-SJ-ROBOT.
Let me get a pen real quick.
Okay, you take your time, Homer.
I got to get a pen.
Thoughts on Homer?
No,
Yeah, let me get a pen real quick. I'll write that down. Where's the pen at? Where's the pen? A pencil?
Well, while he's searching for a pen, what do you think, Doc?
Yeah, I think that just having a complete airway evaluation is the
Hey,
thing.
Coach, I need an ink pen. Okay, hold on. I got a pen.
All right, you ready, Homer?
Let's see. Piece of paper right here.
We understand. Everybody goes through that. There's never a pen
Okay,
when you
hon.
need one.
What is
it's
it?
855-SJ-ROBOT.
Okay. 55
SJ-ROBOT.
robot.
All righty?
Okay, thank you.
All right, we wish you well, Homer.
Okay, you too. Thank you.
Bye-bye. So your thoughts?
Yeah, I think that he's definitely seeking out all the alternatives, and maybe he just needs one more evaluation just to really confirm the sites of obstruction. And he may be on the right path already. The surgery on the jaw, like I said, is very successful. It's just whether he's willing to go through that.
People do become so desperate. Husbands and wives change rooms so they're not sleeping together. And sometimes that's still not enough because the snoring is so loud. Then they worry, but if somebody's not in the room, they're not seeing when they're gasping for breath. So a lot of questions related to it. Let's go to line 3. Michelle is on the line. Michelle, your question for Dr. Gravelin or Dr. Hoff.
Yes.
Go ahead.
I was wondering, how painful is the recovery?
Oh, for the robotic surgery, the recovery time is about 3 weeks. 2 weeks of kind of acute recovery where you're pretty much on kind of a soft liquid diet, taking pain medicines, narcotic pain medicine. So It's like a tonsillectomy. If you know people who've had a tonsillectomy, it's similar
yes,
to
I
that.
had that done when I was younger. Yes.
Yeah.
So do you remember how painful that was?
Yeah. So it's
I was 15, so I really don't remember too much about that, but that's not so bad. Also, my insurance, will my insurance cover this?
yes, it does. We haven't had any trouble with insurance companies. It's standard surgery, just done with the robot, and the insurance companies don't really care how we do it. So the robot is just kind of rolled into it, and there's no extra charge for that.
And Michelle, as we've mentioned, Dr. Paul Hoff has done more of these robotic surgeries for sleep apnea than any other doctor in the world. Can you tell us your situation? Have you been snoring for a long time?
Oh, yes, I've had sleep apnea for over 3 years. I have the machine. I swear in the last 3 years I maybe used it 10 times.
Tell us why.
I feel like I'm going to have a panic attack when I have it on. I feel like maybe it's claustrophobic. I'm not sure, but I just feel like I'm going to have a panic attack
And
when I have it on.
how
And I
often are
can't
you
do it.
waking up during the night? Like, what's your night like?
A lot. Probably about 5 or 6 times. And I snore so bad. And also, I don't feel good the next day. You know, I get really tired. I'm forgetting a lot of things. I try to say something, I'm forgetting what I'm saying. And that's all part of it, I guess, when you're not getting a good night's sleep.
And really honestly, Michelle, how badly has this impacted your life?
Pardon me. Oh, it's affected my life a lot. It is. Because I just can't function really good the next day.
Can I ask how young you are?
I'm 51.
And how old do you feel?
Oh, I feel like I'm 90.
That's what I hear a
swear
lot.
I do.
Mm-hmm.
Yeah, I don't, and then, like I said, the next day, I'm just so sluggish. I can't motivate good, and I just, in the last 3 years since I've had this, and plus I'm overweight, I weigh 230 pounds, so I'm sure that has something to do with it.
Have you ever
But,
considered the surgery?
Pardon me?
Have you ever considered the surgery?
Yeah, I've been watching on TV, you know,
Mhm.
and I was thinking about having it done. And we just got some health insurance now because my husband's got a job now. Before he had cancer, so he wasn't working. And we got health insurance for his job, and I was just wondering if it would be covered. You know, I really would like to have it done.
The place to start is to have an evaluation. Come in, we take a look at you, evaluate the back of your throat, and maybe do a sleep endoscopy if it looks like you might be a candidate. But we just don't know if you're a candidate until we've actually seen you.
Okay. I know that my machine is on a 15. Last time I went to the sleep doctor,
Mm-hmm.
and I had 2 sleep tests done in the last 3 years. So, yeah, I'd like to, is this the only hospital you do it at, is the St. Joseph Mercy?
That's right.
Okay, and where is that located?
Oh, and Ypsilanti, right, sort of Ann Arbor, Ypsilanti area.
Okay, because I live in Lapeer, Michigan.
Oh yeah, we've seen patients from Lapeer before.
Okay, so how do I go about doing this?
So the number to call is 855.
Oh, let me get a pen. Hold on.
Another one.
Yeah, well, I usually sit by my chair and I have a pen, but I was on the couch.
We're going to
Okay.
start handing out pens. You ready? It's 855-SJ Robot.
855-SJ Robot.
Correct. That's 855-757-6268. I'll say it again. 855-757-6268.
All right, I thank you so much for all the
All right.
questions you answered.
Michelle, we wish you well.
Thank you.
All right, talk to you soon. Bye-bye.
Okay, bye-bye.
So one woman who was on the line was asking, she had a severe case of sleep apnea. She wants to know, can it truly be fatal? I think
Yeah.
people don't realize how serious this is.
Oh, the answer is yes, and there's good medical literature that people with severe sleep apnea where it's left untreated actually die from their sleep apnea at night. I mean, if you look at patients with cardiac disease, when do they die? They die in the early morning hours, like on the way to work, when the stress level goes up. If you have sleep apnea and you're untreated, when do you die? You die at night during REM sleep. When your obstruction is the worst and your oxygen levels are at the lowest, and where that's going to stimulate abnormal heart rhythms.
I think if people watch this show, they'll see this. You know, we keep talking about sleep being the fountain of youth. But when you see these patients who came in exhausted, who were waking up sometimes dozens of times a night, go through surgery, go through the recovery, and 6 weeks later are breathing and sleeping and look 10 years younger. It's incredible. I'm sure you have better anecdotes than we do.
No, the patients who have success with this surgery are some of the happiest patients that I have. So I really try to select patients out who I think are going to be successful. And a lot of people come in that they think they're going to have surgery, and I'm very honest with them. I go through all the different treatment options that they have, and if they look like they're a candidate, then we'll go down that road. But if they're not, I'll tell them these are other options. There are other options, but maybe not robotic surgery.
Got it. All right, let's move to line 2. We have Rosalind on the line. Hi, Rosalind.
Hi, how are you?
Great. You're on the line now with Dr. Paul Hoff and Dr. Thomas Gravelin from St. Joe.
Hi, yes. I'm a diabetic and I have sleep apnea, and I was watching the program and I was wondering if that's a good thing for a diabetic to go through.
Surgery is always a little harder with diabetics. It's just because of the postoperative recovery. The intake of food is limited, so you're going to be on a fairly liquid diet. But we do have nutritionists at St. Joe's. So postoperatively, in fact, we have something called the Advanced Recovery Protocol that all patients go through. So we have a visiting nurse come to the house for the first 2 weeks, about every 3 days, just to check on you, make sure that things are going well, you're drinking enough, you're eating enough, your pain's under control. And that we found that's been very helpful for patients, particularly if you have a problem like diabetes that makes it harder to manage afterwards.
And as Dr. Gravelin mentioned, oftentimes it's the sleep apnea that's led to the diabetes to begin with in the case of type 2 diabetes.
Absolutely. At night, if you have low oxygen levels because you're untreated, that causes insulin resistance, which results in higher blood sugars and makes your diabetes more difficult to control.
Rosalind, how long have you been suffering with sleep problems?
Oh wow, that's a really good question. I've been, I want to say at least 3 years, 3 or 4 years.
You think it's been that long since you had a really good night's sleep?
Oh my goodness, I don't even know what good night's sleep is. I didn't go to sleep until 7:30 this morning.
Wow. And you're a
Yeah.
snorer?
I'm sorry. say
And
it
you
again?
snore?
Yes, I do. Yes, I do.
And people complain about it?
My family they worry that I'm gonna not wake up sometimes because I guess I quit snoring so long when I did the sleep apnea test. So I do have a machine, but I don't like using it because it fills my stomach up with air, and that's very uncomfortable to me. So when I was watching the show, I was like, I need to call and find out what I can do, or if there's anything I can do to help me.
What does that mean when she says it fills her stomach with air?
Well, for some people, particularly if they require higher CPAP pressure, so there's more air going in, they'll swallow a lot of that air, and your stomach distends, and they have a lot of belching, and it's very uncomfortable. And we can do simple things like elevate the head of their bed a little bit, and that reduces it, or we can lower their CPAP pressures. But she sounds like an excellent candidate to be evaluated by Dr. Hoff. And if I could just repeat something that Dr. Hoff's already said is, you should come and see him just for the consultation. Find out what your options are. Maybe you're a perfect surgical candidate, maybe you're not. We can help you either way.
When you say you haven't had a good night's sleep in who knows when, at least 3 years, Rosalind, how much is this impacting your life?
It affects us a lot. One, I'm a grandmother, so I was like, I'm tired all the time, so I don't get to do too much with my grandson. And then I'm up most of the night because I feel the pressure of the air going into my stomach, so it's like I'm very uncomfortable, so I can't sleep. So it affects me a lot.
Right. So yeah, it sounds like you're a good candidate to come in and be evaluated. The number to call, 855-SJ-ROBOT, and make an appointment. Okay, Rosalind?
Okay, thank you so much.
Thanks for calling in.
Yes, thank you.
Bye-bye. Patricia, you are on the line now with Dr. Paul Hoff and Dr. Thomas Gravelin. What's your question?
Oh, my question was, after the surgery, what is the procedure and the recovery time period?
So typical recovery time is 2 weeks of pretty sore throat where you're having to take narcotic pain medications, just like a traditional tonsillectomy. If you have friends or family that have had a tonsillectomy, you can pretty much ask them what their recovery was like, and that's pretty much what it is. Then there's about a week after that where you're starting to feel better, you're starting to eat better. Most people lose about 10, 15 pounds, sometimes even more, just because over 2 weeks you're just not eating and drinking a lot. And we try to make sure that you do as well as you can during that time by having a visiting nurse come to the house every 3 days or so. And that's part of the sort of the routine protocol that we have, and we found that's really helped a lot with recovery. And then we get a sleep study after the surgery about 3 months later, and that's when people have pretty much recovered completely. During the first 3 weeks, you get probably about 85% recovered, and then over the next couple months, the rest of the way. And that's kind of the recovery. But I tell people, you can't work during that 2 or 3 weeks. I would say 3 weeks is pretty reasonable to just take the time off work if you can. And that's a big hurdle for a lot of people. I know if somebody told me I had to take 3 weeks off, I'd really struggle with that decision. But that's, in reality, you have to plan for that if you're going to have surgery.
I will tell you, the patients that I've spoken to said, yes, the recovery wasn't easy. They had 2 or 3 weeks where it was a little bit painful. But the payoff was so enormous that they don't even remember those 2 weeks.
Mm-hmm.
So I guess that's something to think about, huh, Patricia?
Yes, what if you're a home care, like I take care of my disabled daughter?
Oh, excuse me?
She takes care of her daughter at home, her disabled daughter.
Oh, yeah, that's an extra challenge, right? Because you're going to have somebody sort of taking care of you a little bit. I mean, you're functional. It's just that you're going to be taking some strong pain medicine, which can kind of make you sleepy and maybe not be able to make the right decisions necessarily. Whenever you're taking a narcotic, you probably have to find some help if you could.
How bad is your sleep apnea, Patricia?
I'm sorry, say it again.
How bad is your situation? How bad is your sleeping?
It's terrible. I don't dream, and I wake up because of her kangaroo pump also through the night wakes me up, so I have to attend to it. So I have a lot of broken sleep.
That's rough. That's
and
rough.
Another question I wanted to ask is, my tonsils are really bad, and I'm 65. So would you be taking my tonsils out at the same time?
When you say they're really bad, are they very big, or are they get infected frequently?
Well, they haven't gotten infected in probably a few years since I retired from, going in and out of the cold. I retired in 2005, but they're big.
Well, for patients who have really big tonsils, they're actually probably the best candidates for surgery. And, particularly in your situation where you really can't afford the time off, there is a procedure where we basically reduce the size of the tonsils. It's called a tonsil reduction. It's a lot less painful. The recovery's a lot faster. And it could be that you just need a tonsil reduction, and you could make a big improvement in your sleep apnea. It may not cure it by any means, but it could improve it a lot. So definitely, whenever I hear somebody has really big tonsils, I'm really excited because I know I can help.
The things that excite a surgeon, huh?
Right.
Right.
Well, Patricia, let me give you the number to call.
Okay.
It's 855-SJ-ROBOT.
Okay.
All righty?
Yes, that segment on TV was really, really helpful.
Great. I'm glad it was informative. I'm glad you watched. Thank you so much, Patricia. And
Yes,
we
thank
wish
you so
you
much for talking
sweet
to me.
dreams. Is all we want for you is sweet dreams. Thanks,
Okay.
Patricia.
Bye-bye. Have
Bye-bye.
a wonderful Thanksgiving.
Thank you. You too. Bye-bye. So we had a question on email. It comes from Donna, and she says, I have a sleep spend and an AFib. Do you understand what she's saying by that? Am I a possible candidate for sleep apnea surgery? So she has afibrillation. Is that
Right. The one problem, the problem is people with sleep apnea are predisposed to developing atrial fibrillation. That's one of the sort of the complications that's associated with sleep apnea. So we'd like to treat the sleep apnea, but people with atrial fibrillation are often on anticoagulants. And if you can't come off of anticoagulants for a good week beforehand and probably a month or so afterwards, then you're really not a candidate for surgery just because of the increased risk of bleeding.
But that doesn't mean they aren't a candidate for other procedures.
True, yeah. Just surgical procedures are very difficult in patients who are anticoagulated. Now, if you're not anticoagulated and you're just on antiarrhythmic medications, stuff to control the heart rate, then sure, then you're a candidate if the anatomy looks right.
But getting that sleep study and seeing you guys is so important.
Right. It can change everything. And pertaining to another earlier caller, poor sleep also lowers pain threshold. So I get quite a few consultations from rheumatologists with patients with severe rheumatoid arthritis and fibromyalgia who also have sleep problems. When we fix the sleep problems, they require less pain medication.
It's amazing how many symptoms simply are alleviated once you just get a good night's sleep. All right, let's move on to line 2. Emily, hi there, Emily. You are on the line with Dr. Paul Hoff and Dr. Thomas Gravlin. How can we help?
Well, I've recently retired, and I'm wanting very much to travel. And my problem is that I have to load up my machine with me, and that's a lot of heavy weight for my luggage. I'm currently on level number 8 for my machine, and I'm wondering how would I, besides the phone number, how would I know if I qualify for this surgery?
Well, let's get some questions done first. How old are you, Emily?
I'm 67.
Any other health conditions?
Well, I take blood pressure medication and thyroid.
And are you overweight?
Yes, I would say I'm overweight about 30 pounds.
Well, it sounds like you probably have mild to moderate sleep apnea, just based on the pressure settings that you have. Have you looked at oral appliances that would be fitted by a sleep dentist? That's a nice option for people with mild to moderate sleep apnea, very portable, and you could use that when you're traveling and leave the CPAP machine at home.
And what is that called again?
The dentists make oral appliances. They're called mandibular advancement devices. It basically is a non-surgical way to treat sleep apnea. It brings your jaw forward, and you just wear that at night. You can find them online, but I think if you have sleep apnea, you probably ought to see a dentist who specializes in the area. And we have a whole list of specialized sleep dentists throughout Southeast Michigan that we can put you in contact with.
I would appreciate that very much.
I've heard people who say, I can't even find somebody to travel with because they don't want to stay with me because I snore.
Well, to be honest with you, I did keep a whole household awake in Salem, Oregon. I was embarrassed. My mom told me, my brother told me everybody was awake because they could hear me snoring in the basement.
Right. I hear that a lot.
And surgery is always an option. We just like to look at all the options, and surgery is. I always try and keep surgery as the last option, unless you're a great candidate, because there's once you've had all the other things, you can just stop them, and there's no harm done. If you have surgery, you have to deal with the recovery, and it's 2 to 3 weeks of recovery, and it's always nice to say you've tried everything else first.
And what do your patients say about when you tell them, I'm using this Da Vinci robot?
Oh, well, it's kind of the sexy thing, It's almost like saying you're using a laser. The robot is just a tool. It allows us to access an area over the back of the tongue that is very hard to see, and it gives us great control. So it's mostly the visualization that you get and the exposure to remove tissue that really wasn't able to be removed effectively before.
So I would suggest finding out, Emily, if you are a candidate for surgery, and then maybe you can take your next trip without any appliance or any machine.
Oh, I appreciate that very much. And I have the number written down already, so
Great.
I will inquire from, I'll go online to see if I can find a dentist that would be able to give me this device also.
Great. All right.
So I appreciate your help. I did find that the discussion was fabulous, and
Good.
I'm so grateful to all of you for allowing me to speak with you.
All right. Thank you so much. We wish you good night's sleep and bon voyage.
Thank you.
All
Bye-bye.
right. Bye-bye. Hi, Val. You are on the line with Dr. Gravlin and Dr. Hoff. How can we help you?
Hi. Thank you for having this program on, first of all.
Mm-hmm. It helps a lot of people.
Yeah. And I usually, if Liza Lazarus is doing something, I always look to see what's going on.
Thank you.
And I started recording it, which I'm glad. I missed it on the, recorded on my U-verse on the DVR, so I pulled out that old VCR.
And do you have sleep apnea, Val?
Yes, I do.
Tell us your story.
So I have mild is what I'm told, like 5 to 7 times a minute I would wake up. And I began using the CPAP machine in February of 2012. And so I've been through a lot of different masks, having issues with that. My husband's happy that the snoring's gone. I did have an issue with my machine. I got a new machine. I just haven't been using it a lot lately. It's like this past year, the season, like allergies. I'm an allergy sufferer, seasonal, and hay fever. And I've just been, it just seems like I'm so dry and what have you. So I just haven't been using it as I should.
Val, how young are you?
I am 57 years old.
And what's your night's sleep like? I mean, if you're waking up 5 to 7 times an hour, that's not too good.
Well, that's what I was diagnosed as in the end of 2011. But I think, I've been doing a lot better with the machine. I haven't actually had another sleep study.
And how do you feel when you wake up in the morning?
Well, since I haven't used my machine in, several months now, since probably, and I know that's bad, but since sometime beginning of the summer. And I'm at the point where I'm feeling really exhausted.
Well, I had one comment. It sounds like you have seasonal allergies. And do you have nasal obstruction? Does that bother you much?
No.
Not really?
Not very, no.
Okay. Sometimes people with mild sleep apnea like you have, just improving their nasal obstruction can help both with the tolerance of the CPAP, and sometimes even just by itself can throw you into the sort of normal and not have sleep apnea anymore. What happens when your nose is obstructed, then your mouth opens and your tongue falls back and obstructs the airway. So if you can breathe through your nose more comfortably, then the sleep apnea can be improved. But that may not be the problem with you.
My concern with Val is she's calling it mild sleep apnea, and how do we know that it's mild?
That's what the doctor said.
In 2011.
Right. So I haven't had, like I said, I haven't had a study, but I did go and see nose, ear, throat doctor. And because I was telling her that I was feeling congestion mostly on the left side of my head. And, I know I sing in the choir at church, and for years it's like I'm always getting this, congestion and stuffiness, and I can feel it like in the ear and on the side of the, on the left side nasal passageways. And I said, that's got something, does that have anything to do with why it's hard for me to wear my mask or what have you? So she did, we did a lot of tests and what have you, and she did tell me there was, I can't even remember exactly what she said. I have to pull my file. But anyway, there wasn't any obstructions or anything there. But there was like a little narrowness and like you were saying, on the nasal passageway. So,
well, I would say if you're
and then I also was dealing with TMJ because I was grinding my teeth at night, and that was a part of me trying to keep my mouth closed with the mask.
Well, it kind of reminds me of people who have the treadmill, but it just is a coat hanger in the side of the room.
Right.
When you have the mask and you're not using it, and you know it would be helpful if you did, I think since you haven't had a sleep study since 2011, that might be the next step.
Yeah.
Have another sleep study?
Well, no, at least a follow-up evaluation and consultation to see what your options are. If you have TMJ, you're probably not a good candidate for an oral appliance. You might be a candidate for surgery. That would be up to Dr. Hoff to decide. And if CPAP was the right modality for you, you might entertain another consultation to see if maybe a different sort of mask would help you, like a full face mask that covers your nose and your mouth.
I've been considering that.
That would be easier for you to use if you have periodic nasal obstruction.
But your life will feel so much better after a full night's sleep, Val.
Oh, I know.
So if you'd like to talk to Dr. Hoff or Dr. Gravelin, the number to call, 855-SJ-ROBOT. All right?
Okay, 855-ASK?
SJ-ROBOT. It's 855-757-6268. I'll say it again.
Okay.
855-757-6268.
6268. Okay, and what were the doctors' names again?
Dr. Gravelin and Dr. Hoff.
Okay.
So Dr. Hoff is the
Bill,
EN.
we've got like a staticky, let me get off the speakerphone. Everything sounds like it's kind of in
Right.
the atmosphere. Can you spell those names for me? Because I'm not
Dr.
hearing
Hoff.
anything
Dr.
clear.
Hoff is next to me. This is Dr. Paul Hoff.
Oh, Paul?
H-O-F-F.
Hoff. Okay.
He's an ENT, because I have trouble saying otolaryngologist, and a head and neck surgery specialist. He's the head of the head and neck surgery section at St. Joe. And like we've been saying, he's done more robotic surgeries for sleep apnea than any other surgeon in the world. And next to him, Dr. Thomas Gravelin, Gravelyn, a sleep specialist at St. Joe. Val, thank you so much for calling.
Thank you so much.
All right, take care.
Okay, you too.
Bye-bye.
Bye-bye.
Bill, you are on the line with Dr. Gravelin and Dr. Hoff. How can we help you?
Doctor, I've already had a UPPP, and I just wanted to know if that surgery is anything that we should look into.
So for the rest of us, tell us what a UPP
Sure.
is.
So back in the 1980s, this procedure, UPPP, or it's got a long name, uvulo-palatal-pharyngoplasty,
Woo!
is
It was a long-ass name. I remember that.
It's basically a procedure that was widely used. It was developed in Detroit, actually, by a famous sleep surgeon, Dr. Fujita. But they basically would take the tonsils out and trim the palate. So the uvula, the little dangly thing in the back of your throat, would be trimmed away, and you'd create a big arch in the back of the throat. This was a great procedure for some people, but it was kind of used for everybody without real regard for the anatomy. So the overall success rate was about 40% or so, not so high.
It was not high.
Right. So fortunately, over the years, we've figured out that obstruction occurs not just at the level of the palate, but it occurs at the back of the tongue as well. And so now we look at all different levels of obstruction, and it could be even at the palate in your case still. So yes, surgery still could be an option for you. I see a lot of patients who've had prior surgery like this, and what we do is this procedure called a sleep endoscopy, where we first evaluate you in the office, and then if it looks like you're a candidate, we bring you to the operating room for a look at your airway while you're asleep under twilight anesthesia, particularly focusing at the back of the palate and the back of the tongue. And if we see areas of obstruction, many people have large, what are called lingual tonsils, or the tongue tonsils. These are different than the ones that you had removed when you were a kid or during your UPPP. If they're enlarged, then you may be a candidate for the surgery.
So if they would have done this way back in the day, then perhaps Bill wouldn't have had to have the UPPP, because they would have known exactly where that obstruction was.
Right, or it might have been a combination of the UPPP plus the lingual tonsillectomy at the same time, which I often do for people. So the UPPP procedure is still alive and well. It's just done often in combination with other procedures.
So Bill, tell us your sleep story. Are you sleeping? Are you snoring? What's happening?
I don't know. My wife doesn't sleep with me anymore, so I don't really know if I snore or not.
Well, what's your wife? Yeah, should we ask your wife? Are you? Hey, can you tell us Bill's situation? Have you heard him snore?
No, but he's always tired.
Right.
Always sleeping.
Got it. So in your estimation, he is not getting a good night's sleep.
No, he's not. And he says every morning when every day, I'm tired.
And is he overweight?
No, he's not.
Mm-hmm. And how young is he?
76.
76.
Has he been using CPAP or any other, like an oral appliance?
He's been using CPAP. He got a dental thing to sleep with in his mouth, and he had a sleep test, and he just had the sleep test, and they told you still have sleep apnea. Yeah.
So he has those devices. Is he using them?
Oh yeah, he's using them.
But still not sleeping.
No.
Interesting. Well, if you'd like to talk to the docs at St. Joe, the number is 855-SJ-ROBOT. And Dr. Hoff, Dr. Gravelin would be happy to meet with him.
Hold on. What is it?
855-757-6268.
Okay, what's the doctor's
And it's
name?
Dr. Hoff, H-O-F-F, and H-O-F-F, F as in Frank,
Okay.
Dr. Hoff, and then Dr. Gravelin, Gravelyn. Dr. Hoff
I'm
and
sorry, Dr. Hoff and what?
Dr. Gravelin, Gravelyn.
YN?
Yep.
Okay. Okay.
All right, best wishes to you. I hope he gets a good night's sleep because then you will too.
So do I, yeah.
All
a
right.
lot.
Thanks so much. Always good to talk to the wife. I think sometimes it must be important for you guys too.
It's much better if the partner comes in. You get the clear story.
Right, you get the real
Yeah.
story.
Yeah.
Real story, how many times they're awake, how tired they are,
Yeah.
what's really going on.
And how much that gap is between when they take that gasp of air and then they're not breathing for a while. And yeah. All right, we have another caller on line 3. Hey, Nadal, you are on the line with Dr. Gravelin and Dr. Hoff. How can we help you?
Hello, hi, how are you today?
Great. What's your problem?
Yeah, the problem, I went to the doctor about 7-8 months, and they tell me, I don't know, they tell me, do you have like sleeping apnea? Because I don't sleep normal, like 7 hours. I wake up 2-3 times in the night. And I don't know, they give me the machine, but the machine is bother me, make noise more than like you sleep. And second, when I turn to the left or to the right with all this wires, it gives me more stress than sleep normally.
Now, the machine is great for those who use it and for those for whom it's easy.
Your voice, I don't hear you.
Okay. Keep going, Nadal. I interrupted you. Go ahead.
Yeah, it's okay, yeah. But do you have any other way, like I can see you, any other way, like easy way, like to help me without all this machine?
Well, I think that making sure that you've had a really good trial with the machine is important. Sometimes you go to a sleep lab and they may give you the machine and not have a lot of follow-up and try to improve your results. At St. Joe's we have a great opportunity to do that. It's something called a PAP nap, and Dr. Gravelin can talk to you about that. But yeah, then there are other options like the use of oral appliances, and if you were interested in surgical treatments, we can take a look at that, but you'd have to come in for an evaluation.
And it's clear from what you're saying that what you're doing isn't working, and so once again I would recommend you come in for a consultation. Let Dr. Hoff look you over, see if you're a candidate for surgery. If you're not a candidate for surgery, there's other things we can do, but I would start with a consultation.
Yeah, but I see, is anybody like they looking for the surgery, or you can see me if I need or not?
To be evaluated for surgery, you definitely we'd want you to make an appointment because everybody's anatomy is different, and you may or may not be a candidate based on a number of factors.
Yeah.
What I like that they do at St. Joe is they take a good look inside to see what's happening before surgery is even considered. So they will know that point of obstruction. They'll know why you're not sleeping and why you may be snoring.
Okay. You want me to take appointment, like,
So yeah, the number you would call is 855 757.
Wait a minute, please. 855
757
757
6268.
6268.
All right?
Like I call and I take the appointment?
Yep, that's right.
Are you in the St. Joseph Hospital?
Yep, at St. Joe's in Ann Arbor, that's correct.
Ann Arbor?
Yep.
Oh, Ann Arbor. Oh.
And Ypsilanti.
Oh, okay. I can't
We
drive over there.
we have an office in Canton as well.
There's an office in Canton too, if that helps you.
Oh, Canton. But you don't have any in the 9 Mile on Southfield?
No.
No.
Oh, you don't have. They have like St. Joseph. I thought, you are close to my. The only way I don't drive in the highway, I have to find somebody bring me.
Yeah, well, it's worth it because if it gets you a good night's sleep, Nadal, it'll make all the difference in the world.
Oh. Okay.
All righty?
Thank you very much.
All right, thanks for calling.
Okay, bye-bye.
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 So when you hear from these people, we've heard from so many people today, what's the one message you really want to get out? Who is not coming that needs to come, where it would make such a tremendous impact?
I think the main focus here is just to make people aware that sleep apnea is a problem. It can be a life-threatening problem in some cases, and that there are many options for people. And at St. Joe's, that we really provide the breadth of the treatment options for people. Anything from positive airway pressure, the CPAP device, to oral appliances, to advanced surgical treatments, and we're really lead in all these areas.
And there's two thoughts there. Number one, we want patients to know you don't take them right to surgery. There's
Right.
a long haul before they make that decision.
Right. Surgery is not automatic, and we like to think of surgery in people who have been highly selected, people who have tried other options, and at that point when we see them, we can evaluate them and hopefully offer them a high chance of success.
For those who do go for surgery, the change is significant.
It's significant. It's dramatic. Many people who have the surgery, it's the best. I think they tell me it's the best thing they've ever done in their life.
My favorite are those who say, not only am I sleeping through the night, but I have sweet dreams and haven't dreamed in years. I think that's pretty remarkable. And Dr. Gravelin, the message you want to get out to people, those who are listening who haven't been sleeping in who knows how long?
Is that we have a multidisciplinary clinic. Every option currently available that's been approved, we offer, and that there's no reason for them to feel tired and to let their life go by needlessly. They would get their blood pressure taken care of, they would get their diabetes taken care of. Get your sleep taken care of, because it'll make a difference in the quality of your life.
They'll drive far just for an oil change for their car. It's so important to take care of our bodies. It's not just exercise, it's not just eating right, it's getting a good night's sleep. And if that's what's missing in your life, take a step, get a sleep study. It'll make all the difference in the world. Again, the number to call, 855-SJ-ROBOT, or you can always go to stjoeshealth.org/sleep. I'm Lila Lazarus. Thanks for tuning in.